I'm Dr. Mendoza, I'm a rheumatologist, and we are going to talk about how to differentiate inflammatory from non-inflammatory types of arthritis by history and physical exam. The single most important step in evaluating a patient with joint pain is to determine whether the pain is inflammatory or non-inflammatory. This distinction establishes your differential diagnosis, it guides your workup, and it guides the urgency of referral. What is the difference between the two? Non-inflammatory arthritis is typically degenerative. It is caused by mechanical wear and tear, as opposed to inflammatory arthritis that is caused by an autoimmune or inflammatory process where the immune system is confused and attacking the joints and causing pain or swelling, or it's caused by a crystal depositing into the joint and triggering an inflammatory response. There are 5 questions you want to ask every patient with joint pain. 1. Do you have morning stiffness, and if so, how long does it last? 2. Does the joint pain get better or worse with activity? 3. Do you have swelling, warmth, or redness in the joints? 4. How long have you had these symptoms? 5. Do you have any other symptoms like rashes, fevers, sores in the mouth or the nose, chest pain with deep breaths, or diarrhea, for example? First, morning stiffness. Non-inflammatory types of morning stiffness typically last less than 30 minutes. It often just takes a few minutes to get going and for that stiffness to wear off. With inflammatory types of arthritis, that stiffness lasts more than 30 minutes to an hour, sometimes several hours, and patients often report that the stiffness comes back with any period of inactivity. Relationship to activity. Non-inflammatory pain tends to get worse with activity and better with rest. And people often report feeling that the pain increases during the course of the day the more they use their joints. Inflammatory pain is the opposite. Patients tend to report feeling better with activity and worse with rest. And sometimes they will even report waking up in the middle of the night, typically the second half of the night, because of stiffness. Swelling, heat, and redness are not typical of non-inflammatory types of arthritis. You may see a little bit of swelling in the non-inflammatory types, but you will not see robust, red, hot, swollen joints in non-inflammatory arthritis. With inflammatory types of arthritis, patients will typically report warmth, swelling, and occasionally redness over the affected joints. Typically, acute types of arthritis lasting for less than 6 weeks should make you think of things like crystal types of arthritis, like gout or pseudogout, or mechanical issues like tendonitis, overuse injuries. You should also consider types of arthritis related to infections like viral arthritis or reactive arthritis. When the joint pain is lasting for more than 6 weeks, that is when you want to consider either osteoarthritis or the autoimmune or inflammatory types of arthritis like rheumatoid arthritis, lupus, psoriatic arthritis, etc. When examining each affected joint, you want to use the back of your hand to assess for warmth. You want to use 2 of your fingers and feel each of the joints and see if they feel soft and boggy, sort of like the way an orange would feel when you squeeze it, or if it feels hard and bony. Soft, boggy feeling to the joints is more suggestive of synovitis, which is more consistent with an inflammatory type of arthritis, and hard, bony feeling of the joint is a lot more consistent with osteoarthritis. You want to evaluate if there is any redness over the surface of the joint, if there is any tenderness to palpation of the joint, and you want to evaluate the range of motion of the joint, and if they're able to move those joints normally like they normally would. Non-inflammatory types of arthritis do not typically present with systemic manifestations like rashes, fevers, oral ulcers. Inflammatory types of arthritis sometimes can be associated with systemic features, and those systemic features can sometimes clinch the diagnosis. So for example, a patient with a rash consistent with psoriasis may have psoriatic arthritis. A patient with photosensitive, meaning sun-sensitive rashes and joint pain and other symptoms may have something like lupus. A patient with diarrhea and chronic joint pain and swelling may have inflammatory bowel disease. Asking those questions should help you differentiate inflammatory from non-inflammatory. Now, if somebody is having an inflammatory type of arthritis, that needs to be referred to a rheumatologist. If they are having non-inflammatory types of arthritis, sometimes that can be managed by the primary care doctor. Sometimes orthopedic surgery can be of assistance, and sometimes other specialists like physical medicine and rehabilitation or physical therapy.